Good morning. Almost 1 year ago, our community began to struggle against the disruptions caused by the COVID-19 virus. Over the last year, all our lives have been disrupted in one way or another by the pandemic. Today, however, I'm happy to report that we can see the light at the end of the tunnel. Vaccine progress is steadily advancing in Lewis County, and with yesterday's announcement from the state, we are hopeful even more of our friends and neighbors will be able to sign up to receive their shot. On behalf of the Lewis County Board of Legislators, your elected representatives in this community, I would like to reiterate that vaccines are safe and effective. All three COVID-19 vaccines approved by the FDA, Pfizer, Moderna, Johnson & Johnson, are scientifically proven to protect individuals from the most serious symptoms of COVID-19. If you are eligible, please take the time to research the vaccine for yourself using reliable sources such as the FDA, the CDC, and the State Department of Health. Remember, social media is not always a reliable source for factual information. We all want life to return to normal. We all want businesses open, kids in school, and to be able to travel to visit friends and family once again. The best and only way for our community to achieve this is for everyone to buy in and get their shot when their time comes. Ryan and Ashley will report on the progress we've made so far and remind everyone on how to sign up for your shot in Lewis County. And with that, I'll turn it over to Ryan.
Thank you, Larry. We're happy to announce today that our active caseload in Lewis County is down to 36 active COVID-19 cases. That's down from a peak of about 260 active cases mid-January. So as a community, it certainly feels like we're turning the corner, which is good. I think a lot of the progress that we've made is due to the efficiency of our vaccine program that Ashley and her team have stood up here in Lewis County. To date, we have given 4,911 first doses of the COVID-19 vaccine in Lewis County, and we've given 2,936 second doses in Lewis County. There's a couple groups that we want to highlight that we're especially proud of. We're especially proud that 53% of all of our first doses have gone to senior citizens over the age of 65. Additionally, 65% of our second doses have gone to seniors over the age of 65. So we've done, in my opinion, a very good job with that senior population who is the most vulnerable and has been hit the hardest by the COVID-19 virus. In fact, there's about 4,755 seniors total in Lewis County, and at this point we can report that 2,616 of them have received their first dose. So about 55% of all senior citizens in Lewis County have been given their first dose. Obviously, we've got more room to grow there. We'd like to get that all the way up to 100, but that's a really strong number, and hopefully some of our seniors are getting signed up and feeling more comfortable once they get vaccinated. The second group that I want to highlight that I think we've done a good job with is our education professionals, so teachers and teachers' aides, people that work in school transportation or other frontline school staff in Lewis County. At this point, we can say any school staff that has wanted a vaccine has received a vaccine in Lewis County. Now, there's still some that are coming, and changing their minds, deciding later and later that they want vaccines, but we're getting them in almost instantly. So two groups that I think we've really done a good job with are seniors and education professionals. In terms of the big picture, the total population of Lewis County is 26,572. The total population 18 or older that's eligible for a vaccine is 20,445. So 24% of our eligible population has received a vaccine in Lewis County. I think that's really good news. In fact, 14% have received their second dose. So we're making wonderful progress. We need to continue to make progress. As Larry said, it's very important that people really see it as their community duty to research the vaccine, get with their doctor, and make a good decision for themselves and their families. But take the time, and it's really on each of us to, if we feel comfortable, get the vaccine, and that's the silver bullet to getting our community back to normal. We do have some good news in terms of more eligibility and hopefully some more vaccines flowing into the state. So Ashley's going to walk us through some of that.
Thanks, Ryan. So yesterday, Governor Cuomo announced some expanded eligibility. So previously, individuals 65 and older were eligible. He reduced that down to 60 and older, as well as individuals starting next week that are public-facing government and public employees would be eligible, as well as any not-for-profit workers who provide public-facing services to Lewis County residents, and essential in-person public-facing building service workers. So anybody basically that's essential public workers interacting with the public would qualify or be eligible to receive the vaccine, which is great. One of the other groups that we hadn't announced formally was restaurant employees and workers, anybody really working in the food industry, delivering meals, and also public-facing hotel workers. I want to encourage those individuals to also sign up through our online pre-registration portal. So we're 3 weeks into having our sign up or our wait list there, and we've had 2,300 residents that have signed up. Today we're down to 800 that are remaining on that list, and with supply of vaccine increasing into the community, I want to make sure that we have a steady number of individuals on that wait list so that we know when we receive vaccine we can call these people and schedule their appointment. We're getting an average of 200 to 300 doses per week at this point, but I do anticipate that that will increase. The individuals that have come off of the list may not have been vaccinated by us. They could have been vaccinated by Kinney's or some other entity, but that's important to note. So anybody who is eligible, I would encourage you to go to the county's website or to call public health at 315-376-5453 to get yourself on the wait list for the vaccine when we get it here in Lewis County. I also want to make a note that sometimes we're seeing people that sign up multiple times. So please just sign up one time. We do have your name. We will be contacting you when we do receive the vaccine. It is a bit more work on our end to deduplicate the names as they come in multiple times. We will hopefully see the Johnson & Johnson vaccine here in our community in the coming weeks. And that will be a great opportunity, being only a one-dose vaccine, for us to vaccinate our hard-to-reach population, our homebound individuals, or those that are shut in. So we've been working with our Office for the Aging, Department of Social Services, Lewis County Home Care Agency, as well as other human service agencies here in Lewis County to gather a list of homebound individuals that we know of, to be able to reach out to them to assess their vaccine status and also desire to receive the vaccine, so that we can make a plan to be able to get out there and vaccinate those individuals. I also want to clarify, because I've been seeing a lot of questions in regard to the 90 days. So individuals that are fully vaccinated, meaning they're 2 weeks past their second dose, no longer need to quarantine if they're exposed to COVID-19. And as of right now, the CDC has said that that's for 90 days. That doesn't necessarily mean that the vaccine is only good for 90 days. That is what we have data for as of right now. COVID has only been around for a year. You know, the vaccines have been around for 4 months now. So we're continuing to learn, and as more data is available, so we can say the immunity lasts 6 months. I'm anticipating those deadlines to be extended. So I don't want people to think that they shouldn't get vaccinated because it's only good for 90 days. that's just what we know as of right now. So please do get vaccinated. And with that, I think we'll take questions.
Yep.
I'd just like to add one thing to Ashley's report, in that those people who are not familiar with the county website, the address is lewiscounty.org. Type that into your browser, and it will bring you to the Lewis County homepage. And on the right-hand side, I think it's a second graphic down, there's a picture of a needle with some vials. Click on that, and that will bring up the pre-admission form that you need to fill out. If you know someone that's not capable, doesn't have a computer, whatever, it's perfectly acceptable for a younger person or someone that has internet access to assist that person in signing that out, signing themselves up. But that's the critical link of between us knowing how many people out there, who they are, that want the vaccine, so that we can request the vaccine from the state and we can get the clinics set up to administer those vaccines. So that's your piece of homework, is to figure out how to get anyone who wants a shot signed up. Thank you.
Yeah, good.
Yes, sir. You can go first.
I don't have any.
I guess the question I had, I know we were talking on the phone yesterday, and I know with this big, backlist of people, and with, supplies kind of, it's increasing, but it's also kind of sporadic. We're not going to see, we might see a big allocation today, but then in a couple weeks we might lull, and then is there going to be a chance that, especially with opening up eligibility next week, as of today, for people 60 to 65, and also next week, is that going to bring more challenges with already the list of people already on the back list? Do you think you guys deserve more vaccine than what you're already getting?
Yes. Yes, Lewis County absolutely deserves more vaccine. There's no doubt about it. We've been advocating from day one for rural counties like Lewis County that are a long distance from the state sites to have a better supply so we can take care of our own people. I provide you guys with some statistics that show specifically our residents are not traveling to Potsdam and Utica, okay? So we really need to take care of those folks right here in Lewis County. So yes, it's very important, especially with the expanded eligibility, that the state provide us with additional vaccines. That's something we've been pushing hard for, and we'll continue to push. But our supply has been steady, I would say. But that's not to say we wouldn't certainly take more if the state were willing to give it to us.
And that supply, what's kind of been the steady? I mean, it seems like there's been a decent increase in allocation over the last week or two. Is that, how much did we get this week, and are you hoping, is that going to continue over the next couple of weeks?
So we have a total of 330 vaccines for this week. We've been averaging 200 to 300 doses the last few weeks, and that is something that I do anticipate to be steady going forward. And like I said, with the hope that the Johnson & Johnson vaccine will be allocated to Lewis County in the next couple of weeks.
I also wanted to ask about, we've been getting a lot of, at least for our station, a lot of emails from rural families, farmers, saying that it's ridiculous. For example, that Coma was at the site yesterday, an agricultural site, and still isn't allowing farmers to be vaccinated. Do you feel that, farmers kind of should be more, with Lewis County being a very rural area, do you think farmers should be kind of more eligible at this point to get vaccinated?
I think the way the state is breaking it down, it's based on people that have the most exposure to the public. So you're talking about the most at-risk population first, which is 65 plus, people with comorbidities. Then you're talking about folks that have a high exposure rate to the public. That is public workers, teachers, healthcare workers. So that's the logic behind the steps that have been taken. However, as a rural agricultural community, of course, we would love to see more of our farmers and agricultural folks become eligible. But then again, we've already got, like Ashley said, a waiting list of 2,500 people, and we're only getting 200 doses a week. So you can certainly say open the floodgates, to more groups, but it doesn't mean they're going to get any quicker. So I think it's something that we need to continue to push as a small rural county that has a lot of agricultural folks. But everybody needs to recognize that getting a spot on the list doesn't necessarily mean you're going to get a vaccine tomorrow. So that's the reality. Ashley, would you add anything?
No, that was good.
I would just add to that the state keeps telling us that there's going to be more vaccine available as time goes forward. So if we have that list in place and there is all of a sudden a bit extra dose of vaccine available, we can respond to that immediately. So it still is critical. Even if you don't think you're eligible, get on the list.
Ryan, it's Julie.
Yes.
This question's for Ashley. Hi, Ashley.
Hi.
Hi. So, can people choose, if you have, for example, multiple shipments or multiple types of vaccines, the Pfizer, the Moderna, and the Johnson & Johnson, can people choose which one they get? Or is it kind of, they get what they're given?
We unfortunately don't have that luxury. So far we've only received Moderna. I don't anticipate us receiving any Pfizer due to storage constraints and the size of our population. So it's a minimum order of 1,000 doses. So I'm not anticipating that will even be an option for our residents here in Lewis County. Now, they can go elsewhere to receive that vaccine. So far at our pods, the only choice has been Moderna. And I'm anticipating when the Johnson & Johnson is allocated, it will be allocated only for the hard to reach populations. So as of right now, we'll only be vaccinating those hard to reach populations, which will not be at our public pod here. So as of right now, Moderna is the only choice if they choose to come to one of our large clinics.
Okay, down the line, if you do, luckily get a flood of vaccines and they are of the two varieties, will people know which ones they're getting? Or would they be able to at that point request one or the other?
They could potentially based on, so we would never mix the two vaccines in one clinic.
Okay.
Number one, Pfizer's spaced 3 weeks apart between the first and second dose, Moderna's 4 weeks apart, and Johnson & Johnson only requires 1 dose. So there's a lot of logistics that go to coordinating first dose, second dose. We would never mix the vaccines into a clinic. If it comes to the point where we have a bunch of Johnson & Johnson vaccine and a bunch of Moderna vaccine, we may do separate clinics and say this is a Johnson & Johnson vaccine, this is Moderna. But at this point, I can't see that in the near future.
I think something that Ashley and I have talked about is we don't really want to encourage this idea of vaccine shopping and waiting for a specific brand or a specific dose. If you're eligible, get signed up, get your vaccine. All 3 have been approved by the FDA. All 3 are perfectly safe and will protect you against COVID-19. So we're hearing that a lot in the community as well. Well, I'm going to wait for this other brand. I'm going to wait for AstraZeneca. I'm going to wait for Johnson & Johnson. That's not really, like Ashley said, a luxury that we have, and we would encourage people to kind of change the way they're approaching the thought process on that.
Thank you both. Another question, how has reaction been going? Like, have people been having any symptoms afterwards that have been reported, and what are the most common ones?
So the reactions vary from person to person. Typically with the first dose, we're not seeing a lot of reactions. With the second dose, we're seeing more reactions, and it's typically fatigue, muscle aches, sometimes a low-grade fever. And again, that's not something that people should be afraid of. It's your immune system responding to the vaccine that we've given you, and your immune system building immunity against the virus, which is ultimately what you want. Obviously, nobody wants to feel crappy, but it is proof that it's working.
Great, thank you. And are people in Lewis County could they still go to the regional hub up at Plattsburgh or to the one at JCC? Is that still possible, or is the only vaccination site possible right now there in Lewis County, the clinics, as we get doses that come in?
They can go wherever they can get an appointment.
Fair enough.
Yep.
All right, thank you. That's all from me.
Another question I had. I think another thing we're seeing issue-wise, not with people, but just across the country, is now we're seeing with going back to, this big wait list of people. Now we also have people that are coming back for their second dose. And so we have to prioritize people who need their second dose while also making sure people is for first dose. Is that with the small allocation that we're seeing right now, or the consistent 200 to 300 with what's already out there? Is that going to be a challenge trying to do first clinics and second clinics with people for first dose and second dose?
No. So based on first dose shipments, we automatically are in the queue for second dose shipments. So when I give our weekly allocation, it is only first doses that I'm talking about. So second doses have been flowing in steadily, and we've had no problem staffing, second dose clinics in addition to first dose clinics. We never mix the two because the first dose is, a lot different than providing the second dose. So it's been no issue here, no.
I'm sorry, I do have one more question. Could you please actually clarify the CDC announcement that people who are fully vaccinated and past that 2-week period are safe to be around people, to gather with people who are also vaccinated? There's been, it seems, some conflicting understanding and reports that don't clarify that it is indeed for people who have also been vaccinated, because you can carry it even with the vaccination. Is that correct?
They're still studying to see exactly how a fully vaccinated person may transmit the virus. So they are still unclear on that. However, they do say the second bullet of that new guidance, in addition to being able to gather with other fully vaccinated individuals, is that you can gather with one other unvaccinated family or group. I forget how they said it. Household, I think, is what it was. So they did give that option. That's the second bullet of that guidance.
Do you have any idea how that would be safe just because it's one family? Like, how does that work?
I think they're thinking density reduction. There's only one other family. It's not a ton of people together. And like I said, they're still studying. So they need data to look at.
Okay,
And
thanks for that.
Yep, with transmission rates being down as well, that's another thing to consider, that things are becoming safer as infection rates decline and as more individuals are vaccinated.
Is there any concern that if people that are vaccinated can be carriers, it's just the thing that has made the virus spread so quickly is the fact that asymptomatic people can spread it, right? So vaccinated people just add to the group of definitely asymptomatic but potential spreaders.
And that's unclear at this point. The CDC is still researching that, still looking at that, looking at data.
Okay, thank you.
Yep.
Anything else?
And then also with expanded allocation, has there been talks of new clinic locations or expanding? What does that kind of look like if we do start seeing more allocations? Are we going to expand past the fire hall, and what kind of other locations have we been talking about?
Okay.
So yes, Lewis County would love to get out and do more clinics in the community. We have, a county larger than the state of Rhode Island in terms of area. We would love to get out to the southern end, the northern end, there's two problems. One, people in the outlying areas need to sign up. If you live in Harrisville, Osceola, Lions Falls, West Leyden, you have to sign up. The numbers that we have on our waiting list don't justify us picking up the whole operation and going down to Osceola for the day. So people in those areas need to make sure that they sign up. The second thing is, we're not really getting a lot of doses from the state. So to pick up a whole operation to go do 50 doses in the southern, 50 doses in the north, and 50 in the center is a whole lot of logistics to cover 150 people. So if we had more supply, hopefully with the Johnson & Johnson, that might help, because logistically it'd be easier to have a traveling clinic where you only have to get people once. But our first, our initial vision was to get out to every part of the community, but the state has not supplied us with enough vaccines to do that. So two things: people need to sign up, and we need to get increased supply in order to do that.
Everything to add?
Yeah, I'm good.
Okay,
Okay.
I'm good too.
Thanks, guys.
Thank you.
Bye, Julie.